Thank you. I want to congratulate the organizers for this event, and thank you to our hosts. I think this is a great initiative. Julio Frank mentioned this morning that he was a health person that was learning to speak the language of economics, and I'm a banker who is learning to speak the language of health. And at the start of the last decade, international assistance for health saw a huge increase in funding because of three factors. Basically, fear, a great sense of urgency, and a lot of generosity. But today, 10 years later, in the fight against the three diseases, we really have generosity. That's what's there. The sense of urgency we will have to create together. And I think this is a great change in these 10 years, and being conscious about it is extremely important. – 2011 was a difficult year for the Global Fund, you all know that, but we're back in business. We are an investment fund. We are the banker for this war, the war against the three diseases. And as a banker, I know a good deal when I see one. And fighting these three diseases is just a very good investment. I'm convinced of that. We can see here some of the obvious results. We all know them. They're fantastic. We have great things to show for the first 10 years of the fund. In the next 20 months alone, we will be investing $8 billion. $5 billion in Africa alone. All this through the refinancing of our current grants, as well as the transitional funding mechanism that countries have just applied for recently. Beyond these well-known declines in morbidity and mortality, the Global Fund's grants have a direct economic impact, and I would like to share this with you because it's very impressive. In applying our interventions, the interventions that you carry out and we finance, we employ 1 million people in sub-Saharan Africa. So it is really tied to economic development. The quality of that employment is fantastic. A lot of them are women, where women employment is not very big. The Global Fund's grants have helped construct and rehabilitate 2,500 hospitals in sub-Saharan Africa. Where we can make a dual investment, we will do it. The Global Fund has invested over $2 billion so far in health systems in Africa. How do I change this? Thank you. This is the most complicated keyboard I've ever seen. Thank you. In changing circumstances, we have had to change the way we do business. In this economic climate, congratulating ourselves for our past successes is not enough. To maintain the confidence of our donors, we're changing the way we work. The strategy our board adopted last year has one overarching goal. We must invest more strategically to achieve better value for money and impact, while fostering the gender and human rights agenda. The board of the Global Fund brought me as a general manager to do three big things: strengthen our foundations, implement our strategy of value for money, and secure the resources. My goal is to leave a legacy of a strong institution with a clear strategy and money in the bank. The first step has been to focus the Secretariat on its core business, grant management. We have organized teams around 20 high-impact countries, 13 of which are in Africa, while strengthening services to all grants. We shifted our staffing so that 75% of our people now work in grant management, up from less than 50%, and we reduced our overall headcount by 22%. Second is to focus our investments in country from results to a focus on impact, so we can ensure the highest returns and value for money through a strategic investment. We are developing a new funding allocation model, considering factors such as income level, funding from other sources, disease burden, service needs, and gaps, and to create a simpler, iterative application process for our funding. We will be seeking to prioritize our investments in key interventions, like better diagnostics for malaria and TB, male circumcision where culturally acceptable, and preventing mother-to-child transmission. We need to learn from our results to guide investments to those not yet reached, so as to help fill the gaps in bed nets, ARV treatment, TB, and HIV prevention. We also need to partner with you to change the way we work with you. The aim of many of our reforms is to reduce the transaction cost and make your life simpler, easier. It's difficult enough to be fighting against this disease, and over the years we have made things more complicated. The problems seem huge, but let's not be afraid of the solution. Working more efficiently, we can make our investments pay off quickly. There is a very substantial gain in productivity in the way we carry out business. And together, we can collect that money and put it to work in the benefit of saving more lives. We have come to recognize the growing evidence that the spending on health in the developing world has both short and long-term economic benefits. A recent article in The Economist, as mentioned this morning, showed how bed nets against malaria are the biggest factor responsible for improving outcomes for children in Africa. We have all heard of the value and returns of high-impact interventions like treating adults for HIV and children for malaria, freeing up between 30 and 50% of hospital beds at any one time, keeping alive doctors and nurses and teachers in whose education and training you have invested at great cost, raising individual productivity by 20 to 75%, cutting absentee rates in companies by up to 40%. These are very fundamental gains in terms of effects in your economies. Yet, the current rate of improvement will not be sufficient to reach the health-related Millennium Development Goals by 2015. Only 41% of the countries supported by the Global Fund are on track to meet the MDG 4 and 6. Only 4 Global Fund-supported countries are on track to reach the target of 67% reduction in the under 5 mortality rate from malaria by 2015. We at the Global Fund can continue to help you leverage your funds and ours with those of other donors. But I need to let you know you will have to do certain things to get these funds. Until recently, we used to call the country participation co-financing. And times have changed, and perhaps the co-financing is the money that is coming from outside. And those of you that make that shift very fast will get a tremendous dividend, because the head-on investment you can share with others right now. Don't fear sustainability. It is way, way, way cheaper than the head-on investment that you can make today. And there's this fear that this huge investment that has been made over the last 10 years, you will have to carry on if you continue with it, and that is not the case. The finance of this is very compelling. You do this head-on investment, you do it now, you can get a lot of leverage, you're getting a discount, and then further on, you will get a break. You can do it. It is not that heavy. But if you don't do it, it's just going to hit you and hit you so much more heavily. And I think understanding this equation is the key to this moment. Some countries have shown us, and this is the case of one country, where with a $120 million investment, we're getting these fantastic paybacks. And this is available for just about any one of you. You have the capacity. Over the last 10 years, the knowledge has moved from the north to the south. You know how to do this. You have gotten very good at this war, and this is the moment to capitalize on that moment. But again, I'll go back to a concept. You will have to create the sense of urgency, and it is my reading that in today's world, we are ready to listen to your proposals for incremental funding, but it has to come from you. It is not coming automatically, and this is very important. There's a great, I think, great receptivity to put up money against very specific, well-defined need in terms of getting the job done, getting these diseases behind before 2015. I thank you very much.